Well, the federal government of Nigeria is currently working on a supplementary budget for the procurement of COVID-19 vaccines that will be presented to the National Assembly. Chairman of the Senate Committee on Primary Health Care and Communicable Diseases, Senator Chukwuka Utazi, says the issue of the supplementary budget has become apparent since enough funds were not provided in the 2021 budget for the procurement of COVID-19 vaccines. April 2021 is set as deadline by the National Assembly for the consideration and approval of a supplementary budget for the procurement of COVID-19 vaccines when submitted by the executive. About 400 billion budget estimates are being projected to cover the procurement of COVID-19 vaccines required for the vaccination of 70% of Nigeria's population. Joining us now from our Abuja studio is Dr. Mukthar Mohammed, a National Incident Coordinator, Presidential Task Force on COVID-19. Glad to have you join us, Doctor.
Good afternoon. Pleasure to have me too.
Good, fantastic. Now, the first of 16 million doses of COVAX procured vaccines, I understand, are free. Why the delay in getting the vaccines into the country? We're supposed to have got into the country, according to the Information Minister, if I'm right, by the end of January.
Yes, thank you very much. We were expecting these vaccines. We actually, Nigeria was planning to have these vaccines through what is called the COVAX facility, which is a global alliance, to support middle and low-income countries to have vaccines. As you are aware, in the last few weeks, there has been a very intense scramble for getting these vaccines. Developed countries are trying to keep it to themselves. The manufacturers are trying their best. However, the demand is so overwhelming. The vaccine politics is actually being overheated by the competition, the growing competition, that is happening globally. And we believe that Nigeria is affected by this vaccine politics. That is why perhaps they are not able to fulfill their pledge of sending these doses of vaccines to Nigeria as promised. They have assured us that these vaccines will be coming very soon. They have provided a date, but it is not something we would want to make public, and it's not something that we are going to say we are 100% reliant on. And therefore, the Federal Ministry of Health and the Primary Healthcare Development Agency are looking at other avenues, including having bilateral talks with other countries, as well as trying to reach the manufacturers directly to be able to secure some doses of this vaccine for Nigeria.
Okay, Dr. Mohammed, if you could help us clarify, perhaps it falls into the same category of vaccine politics, the issues around the amounts being allocated. The former vice presidential candidate, Peter Obi, says 400 billion is too much, that he could help government obtain the same for 150 billion. Could you speak to this, please?
Well, I don't want to join issues with anyone, but these vaccines have their prices and it is open. People can look for the prices and such. What is driving the prices up, I believe, is the competition and the demand that is heavy on the manufacturers. In a few months or years, the prices are going to drop. As you know, in the normal economics of demand and supply, once the production reaches certain critical stage, the prices are going to crash. However, right now, at this heat of the moment, many countries are putting huge demand on these manufacturers, despite the effort that that is being made to ensure that they have increased their capacity. So we know that the prices now are very high and are not sustainable. And even for Nigeria now, we're looking into the future, that when would it be the most suitable, to have the huge consignment that we want. We believe that in the next few months, the prices are going to crash because more vaccines are coming, more companies are getting licenses to produce this, including companies in Africa.
Oh, well, Doctor, correct me if I'm wrong, or maybe you didn't at this. I'm learning that the 400 billion is for a cycle of 2 years, not only 2021, but it'll dovetail into 2022. And it also has to do not just with vaccines, but with logistics and so many other things on the chain.
So that is absolutely correct. And that is just a budget. That is like a placeholder that is being placed. The detailed budget is still being worked out. Like you rightly mentioned, it is not something that is going to be taken out of 1 year. It is something that is going to spread up to 2022. And like I mentioned, this is just an initial forecast that has been made. You have to make provisions for the money. You have to have an idea about how much it is going to cost. But the exact cost that this is going to, the exact amount that this is going to cost has not yet been finalized. It depends on the vaccine that we have, whether it requires the high cold chain storage facility, that's the one that requires the expensive freezers, or we are using the ones that require the normal freezers, or even we are using the ones that may be only 1 doses instead of 2 doses. So all these variables affect the total cost that is going to happen. What happens in budget, just like any other budget for the country, it is a placeholder. It is an estimate that is made just to make sure that there is provision for this important public health activity for the country.
Okay, Doctor, and one of the officials at the Federal Ministry of Health said that we shouldn't be so much concerned with the budget for the vaccines as the plans to obtain them. Are they the plans, the variables you've begun to speak of, are they the issues that we're meant to be concerned about?
Absolutely, because you cannot have the final figure until you have a final determination on which vaccine you are going to use. Is it 2 doses? Is it 1 dose? Does it require the high cold chain dependence, the logistics of moving it, the amount, the people that are required to do this, the upgrade that you require in the primary healthcare facilities to be able to provide the services to the people. So all these details are currently being worked out. So I believe this is the information he's trying to provide, that the budget is just a budget, and that is why it is called a budget.
All right, Doctor, I am really trying to understand why this is coming from Senator Chukwuka Utazi, who says that enough funds weren't provided for in the budget. Can you possibly give us an explanation why ab initio enough funds weren't provided for in the budget? But we're going to have to keep you on purse. When we get back, you will tackle that question. You're still watching News Day. We'll be back in a bit. Don't go away. You're still watching News Day. Glad to have you back. We'll still have Dr. Mukthar Mohammed, National Incident Coordinator, Presidential Task Force on COVID-19. Thank you for hanging in there, Doctor. If you don't remember my question, let me just rehash it. I'm really trying to understand why enough funds weren't provided for in the budget. This is coming from Senator Chukwuka Utazi. Can you help us to a possible explanation, basically?
So there are many factors. Yes, it was not included in the initial provision of the 2021 appropriation. Number one, because discussion was still ongoing. If you remember, as of the early December or by November, budget was prepared since around October, November, before it is finally passed by the executive to the National Assembly. So at that time, no vaccine was even approved for use. And the discussion was more of the containment and mitigation factors. However, we knew that we needed to make provision for the vaccine. So discussions were ongoing at that time, and we needed to have some clarity. And the agency involved and the Federal Ministry of Health were still having discussion with other stakeholders. So it was not deliberate, but it was inadvertent that the budget was submitted without a clear line for the vaccine. And that is why the National Assembly entertained the request for supplementary budget. And this was discussed with both the executives and also the legislature.
Okay, Doctor, I just want to raise the issue of the promise that the first 16 million doses of the vaccine will be free. Now, people on the ground have complained that even where they say testing, currently what we have, testing is supposed to be free, a lot of times it's inaccessible. So they're having to opt for paying 50,000 naira to get the option that is available to them. So are we likely to meet a similar scenario here where on the face of it, the vaccine is free, but when it comes to access, it isn't?
So we need to make distinction between things that are under our control, that is under the control of government of Nigeria, and things that are outside the control of government of Nigeria. The issue of the amount of vaccines that is available to Nigeria is partly not within our control. It depends on availability, the manufacturers, and a host of other factors which the government is actually trying to negotiate and get. As to the amount and time, I think we'll not stick out our neck and say this is exactly what we are going to get at so time, because so far the narratives have been changing. We were promised to have these vaccines by end of January. A lot of excuses were provided. We understand, the factors that have affected, this fulfillment of this promise. But with regards to testing is, I would say, to a large extent under our control. We provide the commodities that are required for the testing. We set up the centers that this testing or samples are collected, and we also provide the manpower. So to a large extent, testing is within the control of government. So what we are doing in PTF is we have encouraged and advised all the state governments, the state governors, to set up at least a minimum of one sample collection site in a local government. Before now, most of the sample collection centers are usually in the state capitals, in the cities. Now we have asked them to do that. A lot of them are trying to do it. Some of the states have actually set up these sample collection centers in most of their LGAs. Some are trying to do. They are training and mobilizing staff to establish these sample collection centers so that testing becomes accessible to everyone in Nigeria. Once samples are collected from these centers, they are now taken to the laboratories where this testing is conducted. We provide routine support to these testing centers in terms of commodities, consumables, testing collection materials, and even repair of the equipment, the PCR machines that they are using. So it is a continuous process, but we know government cannot provide everything alone. And that is why we also engage the private sector, particularly to take the load off the government regarding travel testing, so that people who are coming into the country or people who plan to travel out of the country use the private facility to do the testing. Mind you, this test is a very expensive one, particularly the PCR testing. The equipment are very expensive, maintenance is very expensive. It requires almost 24-hour electricity. If there is interruption, the machine has to reboot and start again. And so government is still trying to bring down the cost of this PCR at private laboratories. But it is something that is an option for people who do not want to patronize the public laboratories.
All right, so how is government trying to bring down the cost of testing at the PCRs that you talked about? That's one. And then you mentioned states. And I am wondering, to create, I think you said testing centers in rural areas, not just in the city centers. But what are states like Kogi and Nasarawa that the PTF has come out to dub a high-risk place to visit? What do you say to that? How are you going to handle that situation?
So let me just clear the impression. The states we mentioned as high risk are states that we found in the last 6 weeks, or we call them the hotspots, that is places where the burden of COVID-19 is very high. And these are places that have tested persons that became positive, over 200 in the last 6 weeks or so. And these places, testing is taking place, place. What we mentioned, we said there are states that are not testing enough. And if you're not testing enough, there is no way you will determine the true burden of the epidemic in your state. Maybe you are just testing in one local government out of perhaps 20 local governments. That is not enough. You have to test more so that you are able to know the status of the epidemic, to know the prevalence, to know the number of people infected, the number of people hospitalized, and to also monitor your mortality. So that is what we mean by the states that are not testing enough. And we mentioned the states that are in denial, are not really accepting it, they are not encouraging it, they are not testing, the isolation centers are closed. And we are talking to these states through the back channel to ensure that they do the right thing. The federal government has provided funds to all of the state governors as funds that will be used for COVID-19. And we had a clear plan, and this plan should be implemented. These funds are specific for COVID activity, and therefore no state has a right to say that they don't have COVID, but they collected our money. So that is the point that we made. You ask also, how is government trying to bring down the cost of testing? You know, when this epidemic started, even the testing itself was an issue because it was in very scarce quantity, just like we are talking about the vaccine. Now there are more technologies that are being made available. Now we have rapid antigen tests, which are equally as good almost as the PCR.
Sorry, I have to interject at this point. I'm told we need to go on a brief break. We'll be back. If you hang on to your thoughts, we'll continue where you left off. Okay, you're watching Newsday. Welcome back. And we still have Dr. Mukthar Mohammed, National Incident Coordinator, Presidential Task Force, on the line with us for COVID-19. Doctor, sorry to have cut in on your train of thought, but kindly continue where you left off on how you're bringing down the burden of the costs on the PCR testing.
So I'm talking about alternative testing strategies to the conventional PCR machines, which are very, very expensive. We now have rapid antigen-based test kits that are available, that have been pre-qualified and approved by the WHO. These test kits are now available in Nigeria. They have gone through the process of validation, and we have found them suitable for use in public. And we've commenced using these testing technologies now. These rapid test kits have an advantage in the sense that you can get your test results in as short as maybe 25 minutes, unlike the PCR that may have to take a minimum of 24 hours before you get your results back. And they are a lot much easier to handle. They are portable, and they cost a lot less than the PCR machines. So, you know, as these technologies are being improved, the availability of these materials also become more, and the cost also goes down. So these rapid test kits, if people are going to use them in commercial purposes, they will cost a lot less, maybe less than 10,000 naira. In fact, that will be on a very high side compared to what the private laboratories are charging now, which is close to 40,000 naira.
Yes, 50,000, I'm told.
All right. Let me take you back to the Kogi and some other states, particularly Kogi, and what's been happening. You know, Doctor, when we discuss, I'm sure if you're not even in the government, you would wonder, why is it that there can't be a harmonized? Why would, for example, someone like the governor of Kogi State be saying that people shouldn't take vaccines and stuff like that, and then talking about the fact that there is no COVID in Kogi State. Isn't that dangerous? Isn't there any way that he could be made to temper his talks and everything harmonized for the sake of all Nigerians?
Well, you know that Nigeria operates, the federal system of governance, and the state governments are kind of more independent or semi-independent, and they govern their territories. But this is science, this is knowledge, and this is fact, and it is reality. People who I'm sure a lot of people, even from Kogi State, do not agree and do not approve of such utterances. It is not only the governor of Kogi that is making that. We've had some religious leaders also make that uninformed pronouncements. And we've also had some members of the public, on social media and others. So that doesn't make people who are doing this different, from the ordinary people, on the street. But when you are entrusted with responsibility, I think it is absolutely incumbent upon you to make sure that every decision that you make, every pronouncement you make, is in line with facts, with figures, and stands the test of time. And we have to be responsible. And if you are responsible, you care for your citizens. You do whatever is within your right to make sure that your people stay healthy, their health is protected, and families and people will be able to go about doing their business in a more protected manner. So the federal government is actually not happy with that. But like I told you, we're going through the back channels. We're talking to other governors through the Governors Forum. And I believe all the other governors are also trying to speak with one voice to say that, people should not be making such kind of misleading statements. So there are concerted efforts to make sure that these things are put aright, and the people of Kogi, just like other citizens of Nigeria, do not become disenfranchised in this COVID response.
Yes, and as you said, Nigeria is operating a federal system. However, I just want to piggyback on my colleagues' questions by saying, because a federal Ministry of Health official also said this is the time when Nigerians should trust and have confidence in government. And so I'm looking to issues like data and transparency. How are you employing these, especially when it comes to holding state governments accountable? Because you're providing funds for, say, things like testing, and you're providing them with vaccines. How are you going to offer a supervisory role in this capacity concerning the assets you're making available to them?
Yeah, so like I mentioned before, we release any funds, there has to be a plan that is approved by the Federal Ministry of Health or the Nigeria Centers for Disease Control. Or if it is a credit, like the World Bank credit that was taken by the federal government, there is a procedure to ensure that the plans are written out clearly. We have indicators, we have time frame within which these activities will be implemented, and we have monitoring mechanisms to ensure that all outputs and outcomes are clearly captured. So we have a system in place. There are mechanisms to go around the states, have meetings, and they report on a routine basis. And some of the reporting they are providing include this issue of number of sample collection sites, number of people tested every day, number of people that are positive, amount of commodities that they have been supplied, amount of commodities that they have utilized. So there is a whole technical team that tracks this performance. We also work through the Governors Forum, particularly the 1 billion naira that was given to the states. So the Governors Forum itself set up a mechanism to set up a very rigorous monitoring and supervisory process, which is superintended by the governors themselves. So, and these, they engaged a civil society organization that is working with all the state governors to make sure that they deliver on this, their what we call deliverables. So we are getting reports from them. They have not yet submitted a final report, but we'll be following up on them to find out the progress that each state is making.
Yeah, Doctor, what provisions have been made for storage of these vaccines? Do we have enough cold storage facilities for the ones that need to be stored as such? Maybe I should add this question to that as well. Tell us the countries we're expecting these vaccines from and the particular ones Nigeria is expecting.
So let me start with the last one so that we can follow the question logically. Right now, Nigeria is very open. There are discussions going on, like I told you, through the coalition for Vaccine Alliance, which is called the COVAX facility. We are working also through the African Union, through a mechanism also to get about 41 million doses of vaccines for Nigeria. The sources of this vaccine, Nigeria is very open for now. We are closely monitoring the performance of the vaccines. We are monitoring the pressure on each of the vaccines that are currently available. We are also monitoring the new vaccines that are about to become available. And so we are engaged with bilateral discussion with different stakeholders, the manufacturers, representatives of the manufacturers, and there are also bilateral discussion with countries such as Russia, China, and India. So all this is to make sure we have not yet finally decided on a particular vaccine that we say this is the one we want to buy. It is all options. It is all looking at which one will work better. For now, we are looking at only a few of the vaccines that will require that very cold chain, very high cold chain dependence, that have high cold chain dependence. We are mostly looking at the ones that will be refrigerated in normal circumstances. But we're also looking at options of very promising vaccines that have not yet come out that perhaps may even be better than the ones that are available. So the Federal Ministry of Health, I know they are in daily discussion, they are in daily follow-up with these manufacturers and also countries to make sure that Nigeria gets the best deal. Now, regarding the availability of cold storage, now this will depend on which vaccine eventually gets into the country. Most likely, we are not going to have only one vaccine, as most countries are also going for maybe an option of two vaccines. Nigeria may end up having also more than one vaccine, and therefore the storage capacity will be actually determined when that decision is made. But for now, the National Primary Healthcare Development Agency is doing its best. The cold room in Abuja has a very large storage capacity. I can't remember the cubic meter of vaccines that it will store, but it is pretty large. And also they have some storage facilities in the states. However, if the vaccine that will require, maybe in large doses, will require this high cold chain storage, so we need to do additional procurement, more procurement of these deep freezers, which are also very expensive and also kind of difficult to get with the competition going on in the market. So it is work in progress. All we know is that several teams are working on this and trying to advise the government on the best strategy to follow.
Okay, well, thank you for all that information. It was actually quite helpful. And we appreciate what you say, that it is a work in progress. However, are some of your decisions circulating around the global discussions to do with vaccine equity and even the troubles people like AstraZeneca and the Pfizer vaccine are having with vaccine production? Are those some of the issues that are also affecting when we'll have access to these vaccines?
Absolutely. These are the issues. These are, in fact, the most important issues. It is not even the funds, but this global vaccine politics that is going on. There has to be access, and people have to realize, particularly the developed countries, that when other parts of the world are not safe, the whole world is not safe. So it is not just enough, for countries, to disregard all moral and conventional standards and just accumulate whatever they have to themselves. We understand that some countries have accumulated more than they require for these vaccines. And this is a technology, it's going to rapidly develop so fast that, if you don't utilize what you have, you realize that you'll probably be running at a loss because the prices are going to crash. But the important thing is to ensure that we have equity in the distribution of these very important commodities. And that is why for us, while we are struggling to get the vaccines, we realize that the most important factor is what we have under our control. And what we have under our control is ability to control the transmission of this infection in country. Hence, the emphasis on our containment measures to make sure that people stay safe, people wear their face masks, we ensure that public places are well secured for people to transact their lawful businesses, and that is why we urge the state governments, we advise them, all of them, to set up these enforcement mechanisms. If we do that in the next 3 months, and we ensure that at least 50 or 60% of Nigerians comply to these procedures, we'll be surprised how the epidemic, how these numbers are going to crash. Because it is not rocket science. This thing transmits from one person to another.
Mohammed. The pity I couldn't ask you whether it's compulsory for everyone to be vaccinated. All right, thank you so much, Dr. Mukthar Mohammed, Incident Coordinator at PTF COVID-19.